Good morning everyone. Today we will learn about pre-adjusted edgewise brackets. Pre-adjusted edgewise brackets are also known as straight wire technique. It is a recent modification of edgewise appliance which is given by Lawrence Andrews, which is based on Andrews' 6 keys of occlusion. Andrews' 6 keys of occlusion are molar interarch relationship, mesiodistal crown angulation, labiolingual crown inclination, absence of rotation, tight contacts, and curve of spee. Now we will see each one of this in detail. Key 1, interarch relationship. It is basically a cusp groove and ridge condition of the molars, the cusp embracing relationship of premolars, canines, and incisor-overjet relation. The mesiobuccal cusp of the maxillary first permanent molar falls within the groove of mandibular first permanent molar. We can see that in the picture. Key 2, crown angulation. In the normal occluded teeth, the gingival portion of the long axis of each crown is distal to the occlusion portion of that axis. There is different angulation for different types of teeth, as we can see in the picture. Key 3, crown inclination. In the maxillary and mandibular incisors, the incisal portion of the labial surface of the crown of the anterior teeth is labial to the gingival portion. In all the other crowns, the occlusal portion of the labial or buccal surface is lingual to the gingival portion. We can see that in the given picture. Key 4, rotation. There should be absence of tooth rotation for optimal occlusion, as the rotated teeth occupy more space in the dental arch. Key 5, tight contacts. There should be tight contacts and absence of any spacing. Tight contacts are an essential part to maintain the integrity of the dental arches. Key 6, curve of spee. The curve of spee should be relatively flat. The vertical distance between any tooth and a line joining the most prominent cusp tip of the mandibular molar and central incisor should not exceed beyond 1.5 mm. In the given picture, we can see the curvature which is anterior-posteriorly following the buccal cusp tip of canine to the molars. Key 7, absence of tooth size discrepancy. Bennett and McLaurin in 1993 gave 7th key to normal occlusion. Disharmony in tooth size can cause malocclusion. Tooth size discrepancy is measured using Bolton's ratio. The basic concept of pre-adjusted edgewise bracket was to program the bracket to have first, second and third order components so that wire need not have any complex bending as required in edgewise appliance. Therefore, plain preformed arch wires can be used to progressively move the teeth to their ideal position. Hence, it is called pre-adjusted edgewise appliance. Andrews' concept was to develop a bracket in which tip, torque and in-out was inbuilt. Therefore, the wire bending was not required to produce desired tooth movement. In this slide, we can see the picture of pre-adjusted edgewise bracket. Indications of pre-adjusted edgewise brackets are correction of mild to moderate malocclusion, intrusion or extrusion of teeth, correction of rotation, overbite reduction by intrusion of incisors, active closure of extraction space. Contraindications. Orthodontic treatment is contraindicated in patients who are poorly motivated and patients with poor oral hygiene. We can see in the picture patient with dental caries and white spot lesion. In such patient, we cannot do orthodontic treatment. There are two types of pre-adjusted edgewise brackets. One is ceramic, which is made up of aluminium oxide and zirconium oxide, and the other one is metal brackets, which is made up of stainless steel. These brackets are most commonly used. Now we will see the advantages and disadvantages of the metal and ceramic brackets. First, the advantages of metal brackets. They can be recycled and sterilized. They resist deformation and fracture. They exhibit the least friction at the wire bracket interface. They are not very expensive. Disadvantage of the metal brackets. They are not aesthetically pleasing. The patient tends to have a metallic smile. They can corrode and cause staining of teeth. They may cause nickel hypersensitivity. In this picture, we can see how the teeth are stained because of metal brackets. Ceramic brackets. Ceramic brackets are made up of aluminum oxide or zirconium oxide. Advantages of ceramic brackets. They are dimensionally stable and do not distort in the oral cavity. They are durable and resist staining in the oral environment. Disadvantages of ceramic brackets. They are very brittle and therefore fracture or crack when undue forces are applied. To compensate for their brittleness, their size is increased, which tends to increase the bulk. They exhibit greater friction at wire bracket interface than metallic brackets. If opposing teeth come in contact with the ceramic brackets, they exhibit an increased tendency for wear. This is due to their higher hardness than enamel. Enamel chipping or fracture while rebonding is a problem often encountered with the ceramic brackets. This is due to their low elastic deformation and higher bond strength. Now we will see the properties of arch wire material. First, spring back. This is the ability of a wire to return to its original shape after a force is applied. High values of spring back means that it is possible to tie in a displaced tooth without permanent distortion. Stiffness. The amount of force required to deflect or bend a wire is stiffness. Greater the diameter of arch wire, the greater is the stiffness. Formability. This is the ease with which a wire can be bent to a desired shape. For example, the placement of coil in a spring without fracture. Resilience. This is the stored energy available after deflection of an arch wire without permanent deformation. Biocompatibility. Arch wire should be biocompatible. Joinability. This is whether the material can be soldered or welded. Frictional characteristics. If tooth movement is to proceed quickly, a wire with low surface friction is preferable. Arch wires are classified based on the materials used and based on the cross section. Based on the materials used, they are classified as gold and gold alloys, stainless steel, nickel titanium alloys, beta titanium, cobalt chromium nickel alloys, optiflex arch wires. And based on the cross section, they are classified as round, square, rectangular, and multi stranded wires. In the given picture, we can see the round, square, rectangular, and multi-stranded wire. Reverse curve wire. These arch wires have reverse curve. They are inserted to intrude anterior teeth and relatively extrude posterior teeth, and it reduces deep bite. We can see in the given picture there is curvature present on the arch wire. In this video, we will see how the reverse curve wire is inserted. Reverse curve wire is used to treat deep bite patients. In lower arch, reverse curve wire has its curvature in downward direction. It causes intrusion of anterior teeth and relatively extrusion of posterior teeth and treats the deep bite patient. In upper arch, reverse curve wire has its curvature in upper direction. In the same way, it intrudes the anterior teeth and relatively extrudes the posterior teeth and treats the deep bite patient. Nickel titanium alloy wire, also known as nitinol wire, was invented by William Butler. It represents the two main elements of the alloy, that is, nickel and titanium. Nitinol exists in two phases. It occurs in austenitic form at higher temperature. This austenitic form is stiffer. At lower temperature, the nitinol transforms to martensitic form. that is capable to bend into various shapes. Properties of night-eye wire. First, the shape memory. Shape memory is the phenomena that transforms the softer marten stick stage to differ authentic phase by passing the metal through a transitional temperature, and in doing so, it reverts back to the parent shape. Superelasticity of night-eye wire. Superelasticity effect is caused by the stress-induced formation of some marten stick above its normal temperature. Because it has been formed above its normal temperature, the marten stick reverts immediately to undeformed authentic phase as soon as the stress is removed. This process provides a very springy rubber-like elasticity. This phenomena is known as superelasticity. In this video, we will see property of night-eye wire. At low temperature, night-eye arch wires are flexible and can be reshaped. When warmed to body temperature, night-eye wire returns to its original shape. Advantages of night-eye wire. They have low load deflection rate, good spring back and flexibility, has super elasticity, you can recycle and there is no breakage problem in mouth. It produces very little discomfort to patient initially or in activation. Disadvantages of night-eye wire. Nickel cannot be used for major correction of torque, root paralleling or closing of extraction spaces, as reasonable amount of stiffness cannot be accomplished by night-eye wire. Leveling curve of spee is difficult to obtain. You cannot use intermaxillary elastic with night-eye wire as wire is not stiff enough to hold the good arch form and prevent tipping adjacent to the extracted teeth. Stainless steel wire. When 12 to 30% chromium is added to steel, it is called stainless steel. It resists tarnish and corrosion because of passivating effect of chromium. Composition of stainless steel wire. It contains 18% chromium, 8% nickel, 70% iron, and 0.2% carbon. It also contains other metals like titanium, manganese, and silicon. Advantages of stainless steel wire are it has excellent spring back action, excellent ductility, it is corrosion resistant, and it has great weldability. Disadvantages of stainless steel wire includes lower spring back than night-eye wire, high modulus of elasticity, and more frequent activations are required. Effects of alloy constituents. First, chromium. Passivating effect by forming strong adherent layer of chromium oxide on surface. Nickel. Stabilizes homogeneous mass and corrosion resistant authentic phase at low temperature. Carbon. Provides strength and hardness. Silicon. Resistance to oxidation at higher temperature and to corrosion. Sulfur. Easy machining of alloy particles. Phosphorus. Lower temperature by sintering. Different types of stainless steel wire includes ferritic stainless steel wire, which is good corrosion resistance at low cost. Strength is not high as compared to marten stick. It is not heat hardenable. Second, marten stick stainless steel wire. It can be heat treated because of high strength and hardness used for surgical and cutting instruments. It is corrosion resistant. Third, authentic stainless steel wire. It has two types, AISI 302 and AISI 304. It is more corrosion resistant. Basic composition includes chromium, nickel, and carbon. In this video, we can see upper and lower arch stainless steel wire of ovoid shape and different size. These are night-eye wire of upper and lower arch which are superelastic in property and ovoid in shape. Night-eye reverse curve wire of upper and lower arch which are used to treat deep bite patients. Preformed stainless steel wire. Stainless steel wires are used in second stage of fixed orthodontic treatment during retraction as it is stiff and do not distort by retraction force. Australian Wilcock wire. In collaboration with Australian metallurgist E.J. Wilcock, Beck sought to develop a wire material. After several years of experimentation, they produced a wire which is tough enough to distribute forces at an optimal level for tooth movement over a considerable distance for a long period of time and with minimum loss of force intensity while doing so thick enough to resist weakening and distortion due to wear and tearing forces. Different types of Australian Wilcock wire includes regular, regular plus, special, special plus, premium, premium plus and supreme. Regular grade wire. It is the lowest grade wire, easiest to bend, used for practice or forming auxiliaries. Can be used for arch wires when distortion and bite opening is not a problem. Regular plus grade. Relatively easy to form, more resilient than regular grade, used for auxiliaries and arch wires when more pressure and resistance to deformation is desired. Highly resilient yet can be formed into intricate shape with little danger of breakage. Special plus grade. Routinely used by experienced operators. Hardness and resiliency of 016 are excellent for supporting anchorage and reducing deep overbite. Premium, Premium Plus, and Supreme. They are in older or increasing yield strength. Because of increased yield strength, there is increased spring back or elastic strain, increased resiliency, zero stress relaxation, that is ability of the wire to deliver over long period a constant force when subjected to external load. Formability, however, decreases. If the wire is straightened by the process of reverse straining, meaning flexing in a direction opposite to that of original bend, yield point of wire reduces. This phenomena is known as work softening due to the reverse straining or Boschinger's effect. A special process of straightening the wire called pulse straightening has been developed which avoids reverse straightening. It permits even the highest tensile wire to be straightened without reducing yield point of the wire. Due to the extreme hardness of A.J. Wilcock Australian wire, special attention must be given to bend it successfully. First, preform the wire by sliding between thumb and forefinger. Do not attempt to straighten the wire by stripping between plier beaks. Hold the wire lightly when bending the wire. Do not squeeze or pull the wire. Never pinch the wire with plier before or during bending. Bend the wire very slowly, pressing with thumb and forefinger, and do not rotate it. Uses of newer Wilcock wire are treatment of crowded anterior teeth, Mollenheuer's aligning auxiliary, mini uprighting springs. They produce very light forces, thereby decreasing anchor strain. In this picture, we can see the Mollenheuer's aligning auxiliaries, which is made by Australian Wilcock wire. Thank you.